Hi, everyone. Thanks so much to those who attended the webinar that we held the other day on feline leukemia and FIV infections in shelter cats. For those who weren't able to attend, please go ahead and access the recording before watching this Q&A session so you have that background information ahead of time. But we had some great participation during the webinar and unfortunately weren't able to get to all of the questions that were asked during the live webinar. So excited to have this opportunity to offer a Q&A session to address some of the questions that came in through the webinar as well as some that have come in through email. Some great questions. I'm excited to further our discussion of retroviral diseases in cats with this Q&A. To introduce myself again, my name is Erin Doyle. I am a veterinarian with our Shelter Medicine Services Department here at the ASPCA. I'm also the immediate past president of the Association of Shelter Veterinarians, so again, a plug for membership for those veterinarians in the audience. Without further ado, let's dive in. So what we did is took the questions that came in and grouped them into several categories. Some of the questions were similar and so have been combined. So if you don't see your exact question word for word, hopefully it's still covered within some of these larger categories and merged with some other similar questions. So the categories that the questions grouped into were questions about viral pathophysiology, questions about sanitation and PPE, questions about vaccinations, diagnostics, group housing, and then last but not least, some really good questions and comments about the overall paradigm shifts with testing and how we're approaching these viral diseases in our cats. Let's dive on into the questions that came in about the viral basics, about what's happening with feline leukemia and FIV when they are affecting our cats. So question number one is, are regressive cats carriers? And the short answer to this is yes, with the definition of a carrier being an animal, including people, who are carrying an infectious disease but not showing clinical signs. Now that said, we often use the term carrier to describe an animal that is carrying and shedding an infectious disease but not showing clinical signs. So for example, an animal that might shed some sort of infectious disease, but we wouldn't know it because they're not symptomatic. Regressively infected feline leukemia cats are not typically shedding the virus. So while yes, technically they are carriers, we don't worry about our regressively infected cats infecting other cats. They're not infective. Another great question is in regards to the prevalence data that I shared about that 3% average kind of number that we tend to get when we look at prevalence of retroviral diseases in cats. And this great question was, what cats are we talking about when we say 3%? Are we talking shelter cats? Are we talking all cats? Are we talking owned cats? And the short answer is all of the above. That 3% is sort of a ballpark amalgam related to a lot of different studies that are out there in the literature that look at prevalence data. And those studies happen with a variety of different populations. So some are in regards to shelter cats, some are in regards to cats that are coming into a private practitioner, and other studies are looking at samples submitted to reference laboratories. So the short answer is that we are talking about all cats when we talk 3%, but the slightly more complicated answer is that that's just sort of a ballpark that groups together a lot of that data together. And then last but not least, in terms of questions about the basic viral pathophysiology, is why is there no abortive infection for FIV? And here's why I mentioned at the beginning of the webinar that sometimes we can very handily group these viruses together and talk about them collectively, and sometimes we can't. And here's one scenario where we can't. The reason that there is no abortive infection for FIV just basically has to do with the behavior of the virus and how a cat's immune system reacts to the virus. And so there's a lot of different ways after they're infected that feline leukemia will take sort of a different path in terms of the body's response, the cat's body's response versus FIV. And so that's a long answer to say just basically because the viruses do have some differences, this being one of them. Moving on, we had some great questions surrounding sanitation and PPE. PPE standing for personal protective equipment. And I want to be sure to plug that we have some great resources on ASPCApro focusing specifically on these two topics and getting into more depth about sanitation protocols and PPE use in general. So we'll scratch the surface of it related to retroviral infections today, but please seek out those resources for more information on these topics. The first question being, what PPE do we need to wear when we're handling retroviral infected cats? And PPE in common use might include things like gloves, gowns, masks, hair covers, those sorts of things. And the short answer is basically nothing's additional for when we handle retroviral cats. We recommend basic hand hygiene, like we would recommend between most of our shelter animals, so washing hands, hand sanitizing, or wearing gloves. But we don't have to worry about spreading FeLV or FIV ourselves from cat to cat. These are really diseases that are transmitted via direct contact between cats themselves. Now, we do have to worry about giving disease to our retroviral infected cats in our shelters. Remember, these viruses affect the immune system, and so that is going to make these cats more susceptible to other illnesses, things like upper respiratory infection and other sorts of infectious diseases that we might see in our shelter cats. And so we do want to be conscientious to practice good hand hygiene before we handle retroviral infected cats as well. And we also want to be thoughtful about the order that we interact with our cats. So it might not be prudent to be in the isolation ward with a lot of cats sick with upper respiratory or panleukopenia or other sorts of infectious diseases, and then go to our retroviral infected cats. We want to be mindful that we're interacting with our cats in a thoughtful and mindful order to reduce the chance that we're spreading disease. The next question we got in focusing on sanitation is actually a very similar question because it is regards to fomite control. And for those that might not be familiar with the term fomite is basically any sort of object that might spread disease from one animal to another. And the most common fomite in a shelter setting are our hands. So in a sense, the answer to what do we need to do in regards to sanitation for fomites to prevent retroviral transmission is the same answer as to the previous one, and that we really don't need to do anything special. The risk of transmission via fomites is exceedingly low to non-existent. We want to continue to practice good sanitary procedures for all of the other infectious diseases that we might worry about in our shelter cats, but retroviral disease not necessarily being one that is a focus for this fomite control. That said, we do want to be sure that we're practicing basic standard of care. So in theory, we could transmit feline leukemia between our shelter cats if we were moving food doles between cats without cleaning them, sharing needles between cats. So just these basic standard practices we certainly want to avoid. But as long as we're practicing reasonable sanitation, we don't have to worry about spreading retroviruses between our shelter cats. Continuing to speak about sort of infection control, we had some great questions about vaccinations. And so I'd like to go through those now. The first one actually being about other vaccinations. So not talking about vaccinations against feline leukemia or FIV, but what about all the other vaccines that we recommend for our cats? In particular, our rabies vaccine and our FERCP vaccines, our core vaccine. And the question is, should we give those still to retroviral infected cats? And the answer is yes. It's a great question because we know these retroviruses affect the immune system. Vaccines rely on a functional immune system to work. But thankfully, we have good data to show that our core vaccines, our rabies, our FERCP vaccines, still work for cats that are infected with FeLV or FIV, and there is no increased risk of side effects. So it's important to continue them on an appropriate vaccination protocol, just as you would for your other shelter cats. The remainder of the questions we got focused more specifically on our FeLV and FIV vaccines. So talking about our FeLV vaccines first, one question came in is, do we need to use the same brand of vaccine for boostering? FeLV vaccines are vaccines that do require a booster to achieve full efficacy, but thankfully it does not need to be from the same manufacturer. similar to how we might vaccinate our puppies or kittens with a vaccine in the shelter, and then they would go on to, with their owners, to a private practitioner for ongoing booster vaccinations that may not be the exact same brand as our shelters. Similarly, with the feline leukemia vaccine, it does not need to be the same brand. Great question, though. Another question came through was looking for clarity about how the feline leukemia vaccine might impact our diagnostic results. So we talked about how the FIV vaccine does create positive results on our point of care ELISA tests for feline leukemia and FIV. Thankfully, we don't have the same concern for our feline leukemia virus vaccine. That will not show up positive on our point of care test. So thankfully, that is not an issue for feline leukemia virus. Moving on to talk about the FIV vaccine, there were some questions about the fact that it was discontinued in the United States and Canada, but could we still see positive results related to vaccines that might have happened prior to it being discontinued? And the answer to that is yes, we might. It was discontinued in 2017, and so certainly recently enough that we may still see cats come through our shelters that might have been vaccinated. Now, thankfully, the vaccine was not necessarily in widespread use, and so it would be uncommon to see that. But if you do have a community practitioner partner, one of your local veterinarians that was using the vaccine more regularly, or some scenario like that, where you have a higher reason to think that the vaccine might have been administered to cats in your community, then you might still see positive results. But by and large, most of our positive FIV results that we see in shelter practice are related to infection. And another question that came through was, why is the FIV vaccine still available in other countries? The short answer is that I don't necessarily have that depth of knowledge to know all the details to answer that question, but I can offer that each country may have its different risk and benefits to FIV vaccination related to the husbandry of cats in that particular country, whether cats are primarily indoor, outdoors, what is the state of animal welfare in that country. And so there will be different factors that affect decisions about vaccinations depending on what the community standard is for caring for cats. There are also different regulatory processes and different economic markets that will impact what vaccinations are on the market. So while I can't tell you the specific details, there are some factors that very legitimately might affect what vaccines are appropriately on the market in different countries versus ours. Moving on, let's talk about diagnostics. This is, of course, a hot issue for retroviral infections right now, and we had some great questions in this topic as well. One of the first questions that came through is there value in testing 8 to 9 week old kittens for FeLV and FIV? And so here's a question where I'm going to separate out these two diseases. Because for FIV, no, there is not a lot of value in an FIV test for an 8 or 9 week old kitten, because in this population, a positive result the vast majority of the time is just reflective of maternal antibodies. And so it does not reflect an actual infection for the kitten. That said, for some shelters, it may make sense to not stock separate feline leukemia tests in their inventory. And so you can still run a combo test for both viruses on kittens this age and just interpret the FIV results with caution, knowing that interference on the results of maternal antibodies. Now, for feline leukemia virus, it's a different story, and there is a tremendous value in testing our young kittens for feline leukemia virus. I recommend testing, if you're doing a selective testing protocol, then you might only be testing kittens that are high risk. But you can start that testing very young, as early as 3 to 4 weeks, if not even a bit younger, with the caveat to remember that it can take up to 30 days after an exposure to see a positive result. And so if you have a kitten that you are worried about feline leukemia infection that initially tested negative when they were quite young, it may be worth retesting if you are still concerned, either based on their clinical signs or exposure history. But I do recommend testing young kittens for feline leukemia virus. Another great question is, should whole blood or serum be used for ELISA testing? And as a reminder, ELISA testing is our typical point of care tests that we're doing for our cats. And this is a really great question. It's actually one that I reached out to Dr. Julie Levy, who's an expert in this field, to get her input on, because our thoughts have changed a bit over the years about what our answers mean if we get different answers on whole blood or serum. And just as a reminder, serum is what if you spun down the blood in a centrifuge and then ran the test, that would be on serum. And so essentially where our thoughts are now is that the testing, particularly talking about feline leukemia virus, our testing on whole blood is more sensitive than our tests on serum. And so that means if there is a low viral load in the bloodstream, you're going to be more likely to catch it on a test run on whole blood versus a test run on serum. And so if you have a cat that shows up positive on an ELISA test for feline leukemia on whole blood, and then you spin the blood, run it on serum, and that cat is then negative, that may mean that they have a low viral load in their bloodstream. And this is something that can occur with regressive infections, and so that pattern of testing might point you into that direction. We don't know for sure, but long and the short of it is if you have a positive test on whole blood, regardless of the result on serum, you should still be worried about infection for that cat, either regressive or progressive infection. So there is still value in repeating a test on serum and that it gives you a slightly different picture of what might be going on for that animal, but a negative test on serum does not rule out infection if you've had a positive test on whole blood. Most of the time, whole blood is far more convenient to do our tests on because we don't have to go through that extra step of spinning down the blood. And so doing our screening tests on whole blood is still generally recommended. Another great question that came through is what is the difference between PCR and IFA tests? So one thing that I did not get into in the webinar, just for the sake of time, was confirmatory testing. We didn't get into the details there. And so our confirmatory tests generally fall into three categories. The first category of confirmatory testing we could do if we get an initial positive result on an ELISA test would be to actually just repeat that ELISA test, whether that's right away or waiting a period of 1 to 2 months and then repeating the testing. So that is one form of confirmatory testing. Another form of confirmatory testing is to send blood off to a reference laboratory for a different type of assay. And here's the two options we have here are the PCR and the IFA tests. Both of these tests are going to test for a feline leukemia virus infection that has gone through the bone marrow and has progressed either to a regressive or a progressive infection. So it is not going to test positive. You would not expect the PCR or the IFA to test positive with an abortive infection or one that is going to clear. IFA used to be the standard confirmatory test, but there are a fair number of false positives or negatives with this IFA test. So it gives you good information, but there are some limitations. PCR testing is a test that has a lot of momentum right now. It still does the same thing as the IFA in that you can see if you get a positive, it points you in the direction of a regressive or progressive infection. IDEXX is now also offering a quantitative PCR that actually can give you some numbers on how many viruses are identified in the PCR, and that seems to be able to show whether it is a regressive or progressive infection. So it can give you some more information, whereas the IFA would just be a flat positive or negative, and a positive you wouldn't know for sure whether you were dealing with a progressive or regressive infection. So the difference is that there are different types of molecular tests, and it does look like the PCR can probably give us more information than the IFA, although they are both still perfectly acceptable confirmatory tests to use. And then the last diagnostics related question I think is a great one, and one that came up actually in a few different questions from different folks. And that is delving a little bit more into what about queens and kittens? And so I touched on this very briefly in the webinar, but did not get a chance to expand. So I'm happy to have this opportunity to do so here. So the question is, why would you end up with a queen and kittens that have different results? And so basically kind of going back to the charts that I put up in the webinar that look at what could a positive or a negative result mean. And here to a large extent, we're talking about feline leukemia virus again, as with most of these questions. And so cats can have a negative result if they have no infection, if they have an abortive infection, if they have a regressive infection. And so if you have a queen in litter mites, you might have a queen, for example, that has a regressive infection, but may still have previously been at a point where she could spread the virus. And so she might test negative, even though her kittens might be positive. Or so on. And so you might have kittens in a litter, some of whom will test positive if they've developed a progressive infection, but others in the litter, if they've been exposed from mom, might clear the infection or might have a regressive infection. And so because of all these different reasons that you can get a negative or a positive test result, you can see queens and kittens with different results, even within the same family. And so here is why there's tremendous value in testing everybody. Testing the queen and each litter mate, if you're going to test them. Again, if they are low risk, then it's up to your shelter to decide what the best protocol is for you and whether you should even do any testing within the shelter for these cats. But if you're going to test them, it is worth it to do it right so that you get value out of that test and test everybody individually. Pooling samples is not recommended. So I know some shelters will take blood from all of the kittens, mix it together, and then run a test on that pooled sample. But that runs a lot of risk of a false negative result. If you just have 1 or 2 kittens in the litter that are testing positive and the rest are negative, the pooled sample might dilute out those positives such that it's undetected. And so it is really worth it to test everybody. Otherwise, you just can't trust your results at all. All right, moving on to some questions that focused on group housing. And I think this is going to segue us nicely into our last topic next in terms of the paradigm shift, because I think group housing to some extent really highlights some of the questions that might come up if we do selective testing in our shelter cats. So one question was very much that, should we test all cats entering group housing in the shelter? And then for both FeLV and FIV being the follow-up question to that. And so the AAFP guidelines, as well as for our own adoption center at the ASPCA, we choose to test for FeLV and FIV all cats that are going into group housing, and that is what the AAFP recommends as well. At that point, we know that there's some limitations to our single point in time results. But that said, there is still a lot of information to be gained from that result, and that most cats that are negative on a combo test are going to be negative, and most cats that are positive are going to be progressively infected with FeLV or infected with FIV. And so there is still value in that result. For a low-risk cat who's individually housed, that value it may be low enough that it's not worth testing in the shelter and better done in a long-term relationship. But for our group housed cats, that value is often worth it to mitigate risk of transmission. Not completely avoid, as we'll get to at the next question, but to reduce that risk. That said, there are some programs that are choosing not to test their cats prior to group housing. Thankfully, even with group housing, our transmission risk is still relatively low. And again, there are some limitations to that testing, and particularly when we talk about FIV. Testing for FIV in group housing, again, the AAFP guidelines, as well as our own programs, we do test for FIV prior to putting cats into group housing, but we know that the risk of FIV being transmitted in a stable community of adult cats is exceedingly low. And so as long as we're making reasonable efforts to choose wisely who goes into our group housing rooms, as well as to make sure that there is no fighting happening, then the risk of FIV transmission is so low that there's certainly a reasonable argument to be made against the need to test for FIV ahead of time. But for feline leukemia, there is still some risk of transmission, and so it can be worth it to test. That said, another question that came up highlights what we've probably all experienced at some point in our career, and that again, our single point in time test results, there's a limitation into what they tell us. And so there are scenarios that will arise in which we have a cat that tested negative, but down the road is retested for whatever reason and is positive for feline leukemia virus. And so if that happens, the question is, what do we do about the cats that have been with that cat in group housing? And well, thankfully, even though cats can transmit feline leukemia virus through prolonged contact of grooming one another, sharing food bowls, um, there is still a relatively low risk for our group housed cats, unless we're talking about a sanctuary environment. Those environments, you'd have a much higher risk of transmission, both because of the long-term cohabitation and also some of the stressors that can be associated with those environments that increase the susceptibility of cats to retroviral disease. But in a traditional group housing shelter in which there is some degree of turnover as cats get adopted, that transmission risk is still quite low. And so while retesting cats that are still in your care can certainly be valuable to do, remembering that 30-day window that it can take for feline leukemia infected cats to show up positive after an exposure, it still may be warranted to retest the cats and to notify adopters, but certainly with the reassurance that the risk is quite low, that you are going to see that transmission of cats between cats. And last but not least, let's talk a little bit about our paradigm shift. We had some great questions that really kind of delved into the fact that we are talking about not testing all of our cats. The first one we touched on briefly in the webinar, but I wanted to revisit it, is how do we communicate this shift with private practitioners in our community? And I do think it is really valuable to be proactive and transparent in communicating with the community veterinarians so that they have a heads up, so that they're not taken by surprise when cats are brought into them by clients and they can understand what was done for that cat at the shelter. That said, the AAFP guidelines that talk about this shift in paradigm for shelter cats are available to all veterinarians and are something that veterinarians will familiarize themselves with. And so know that this might not be new information to private practitioners as well. But I think reaching out and just letting them know what the shelter is doing is very valuable. And if need be, pointing them towards those guidelines. But again, knowing that most veterinarians may already be familiar. I also think it's very important to keep that channel of communication open so that if that practitioner does see a client and a cat that does end up testing positive for a retroviral illness, there's clarity about kind of what the shelter, what options are available for the shelter, the client and that veterinarian in terms of contacting the shelter and discussing that cat's care. Not that the shelter needs to take responsibility for that cat, but keeping that line of communication open so that questions can be answered, and again, that there's real clarity about what next steps might be if that cat is no longer the right fit for that client or owner. Another comment that I've sort of turned into a question a bit for this format was a really great one, and it was, are we devaluing the importance of a negative result and artificially increasing our prevalence by only testing high-risk cats? And I think this is a really interesting point and a really valuable kind of thing to discuss. And that yes, it is very important. Negatives are information. Negative test results are not meaningless. They mean a lot, in fact. And so I certainly don't want to devalue a negative result. The question, though, is in the inherent value of that result. And we know there are limitations in the value of a single point in time result for a low-risk cat. And so while, yes, knowing a negative status for a cat has value, it's a matter of whether that value is sufficient to warrant the resources in a shelter environment. And in terms of artificially increasing the prevalence by testing only high-risk cats, yes, in a sense, that is what we are doing. And that has to do with going back to how our tests' inherent accuracy or sensitivity and specificity are impacted by testing for a disease that is uncommon in a population. And we are going to enhance the accuracy if the cats that we are testing are more likely to have that disease. Yes, it is artificial. And so if we were doing a research study in which we wanted to look at prevalence of these retroviral diseases in cats, we certainly would not want to create any artificial parameters that might cause the disease to seem more prevalent or less prevalent than it actually is. But when we are talking about value of testing in a shelter, and a shelter in which resources, both financial resources to pay for tests as well as our own time to run and interpret the tests, and then in that scenario, the value of that negative test result or modifying our population to test high-risk cats, then there is inherent value of that in a shelter setting. But I do think that ties well into the last question, which was why use resources to test low-risk cats at all? And without having the questioner in front of me to ask for clarity, I'm not quite sure whether we're talking about for testing low-risk cats while they're with the private practitioner in the context of the long-term client-patient relationship, or if we're talking about testing low-risk cats in the shelter that might be going into group housing, might be part of a legal case, might need more advanced intervention, that we might want that minimum database. But I think the answer is similar in both scenarios and goes back to the value of that negative result or a positive result. Yes, there are limitations to our point-in-time test, but it's still meaningful information if you can follow up on it properly and interpret it properly. And so for right now, a retroviral test for both FeLV and FIV is considered part of the minimum database that we should know about our pet cats to help guide their long-term medical care and husbandry. And so even though that single point-in-time test result is going to have its limitations, it's still considered valuable overall for that cat's life. Again, in the context of a long-term relationship for our low-risk cats, so that follow-up testing or decisions made in the context of that cat's lifestyle can be made in the confines of a long-term care setting like the client's home. But there is still value in knowing that information for all tests. It's just for all cats. It's just a matter of whether that value outweighs the resources it takes to test that cat in a shelter environment, in which we are limited in what we can do with that information because we are not housing these cats long term, and so do not have that opportunity necessarily to do as much follow-up. Hopefully this helps. Those are some great questions. I know threw a lot back at you. If you have more questions that weren't covered, please feel free to reach out. The best way to get a hold of me is through the sheltermedicine@aspca.org address. Or if you asked one of the questions that I covered, but I didn't quite get your meaning correctly, please don't hesitate to reach out to clarify with more background on your question, and so I can answer further. Thanks so much again for your time for both today and during the original webinar. And I'm excited to talk to you again soon sometime in the future. Thanks again. Bye.